All right, discussion time.
Yes.
The healthcare system seemed to work pretty well for many, many years, and then something changed. I don't know if it's the last decade or two. Or how do you define what changed to cause these costs to spiral out of control and what we were dealing with today?
Yeah, so I'd hit a couple stages. We had a rising cost trajectory with the advent of HMOs that actually slowed for a period of time, but then much backlash on how that controlled cost. I've been asked before, what's different now? Yeah. I think what's different now is this is not I will tell you at Blue Cross, this is not a top-down insurance company driving all the change. I think this is a partnership model where we, at the end of the day, providers, tech companies, others that are helping deliver that whole care experience at a better health outcome and a lower cost. And I think we have increasing evidence in Medicare, in the private market, in multiple settings that is possible. We've got about 30% waste in the system. Wow. I mean, imagine that. 30% waste on the amount of U.S. healthcare spend is close to $1 trillion of waste. Huge opportunity for our nation to improve health outcomes and lower healthcare costs.
And a lot of innovators in the room. How can innovation address some of these issues, needs, opportunities? How do you think about that?
Yes.
Where the innovations are back at CVS.
Yeah, I was in charge of the Innovation Center. Also longest serving there. I don't know what this says about me or those jobs.
Maybe we'll keep you for a long time here in North Carolina.
Yeah, exactly.
I hope so.
That'd be great. You'll be part of that decision. I think there's a huge opportunity. I mean, I'm excited. Many of you may track this even closer than I do, but the amount of VC and other investment going into healthcare, I think, is incredibly exciting. I think we're just on the nascent edge of what data and analytics, artificial intelligence, predictive modeling will mean in healthcare. I think huge opportunity there. I think in the sort of consumer-driven space, I think thinking about the care experience. I didn't talk about this earlier on customer experience. You've heard me say this, but Blue Cross North Carolina is about a 20 Net Promoter Score. It's actually really good for a health plan.
The fact that you even know what it is good.
Yeah. Right? But there's no health plan in the country that is a 60 plus, but what would it look like if we were a 60 plus? What would it take to get there? To have a customer experience that is so great that it's on par with the Amazons, the Apples, the others of the world. So those are the type of things we're thinking about, and we'll need help to get there. So
it actually leads in beautifully to all the big conversations going on. There's a few that didn't happen a year or two ago, but CVS Aetna, more recently Amazon, Berkshire Hathaway, JP Morgan. What do you think happens with them entering the health plan market? Yeah, I think disruption and competition is exciting, just as a high-level comment. And then, specifically CVS Aetna, I think is interesting because, one, I think there's obviously a consumer play there that they're trying to make. I'm not, from what they put out publicly, it's not clear they fully realized what that consumer play will be or will not be. There's parts of the pharmacy benefit management business as well that I think CVS is maybe doing sort of an arbitrage, realizing that business model could have challenges in the long term. The other, the Amazon, Berkshire, JP Morgan. Yeah, what does that mean?
I think they were pretty honest that they're big employers that think healthcare is broken. And so they want to, I don't know that they know exactly what they're going to do yet, but I think they're saying we're going to apply our knowledge around consumers, data, technology, and change management to try to have a higher performing system. I've interacted with some of the folks that are part of that already.
Last week or so, I think.
Last week or so, yeah. Right. And I think, I think they'll have to think about what they do themselves and what they partner with others to drive change. All in, there's still a little less than 1 million people. So, Blue Cross insures, 4 million and growing. Right. So they're on some level, and they're 1 million spread out nationally. So on some level, they're not quite as large a footprint as you might imagine, but I think they have this advantage of how they apply their knowledge into the consumer space. And what does that mean from a disruption standpoint?
You think they'll add other big companies to it, if you were to guess?
Yeah, I don't know for sure. I think not in the immediate term, but my guess is they build momentum that they would be open to add additional companies.
Okay, how about Apple, Google? We've heard of these companies. I mean, what happens when they enter the healthcare world, or will they, and how, and what's your views on that?
Yeah, so I'd say two thoughts. I think there was a phase where Apple, Google, and Microsoft all tried to go into healthcare, and as some of you may know, not particularly successfully. But now I think we may be at a different phase. I think Google's work with Verily, which we're actually in discussions with Verily on how we might partner in a few areas, I think is really interesting, how you use big data in devices and other things. I think Apple on the device side as well. The Apple Aetna partnership with 1 million Apple Watches. I don't know exactly what will happen there, but it's interesting to think about how you might utilize that data in positive ways. So, from my perspective, the more of these sort of large companies with significant investment potential and I'd say a consumer focus that honestly is just stronger than most of healthcare, if not almost all of healthcare.
Right.
I think that's exciting, and I think it's exciting for the healthcare system.
So with all the uncertainty in the future of healthcare, does that make this a good time, bad time, advantage, disadvantage for entrepreneurs, investors? How do you think of it, arbitrage, that side of it? Uncertainty means what?
Yeah, so I'd say I'm first going to answer from my former regulator hat, because this does matter in today's environment. Regulatory uncertainty is not good. So when I was at CMS, I was usually the one who said, we need to provide regulatory certainty for longer term, because then people can invest, because they know what the game is, they know what the rules are, they know what the outcomes that we're trying to achieve are. And I am worried right now certainly on a national level that regulatory uncertainty, as you know, our marketplace rates were 14 this year. If we would have had regulatory certainty, they would have been 0. So that's just a data-based number of what regulatory uncertainty breeds. The flip side of that, the sort of uncertainty of all these new entrants, that's exciting, because I think that's where change happens. And I think, I wasn't kidding. As I travel around the state, I was with a hospital CEO yesterday, which I don't think would have happened 5 or 10 years ago, that said, we want 100% of our population in full risk arrangements with you, and we want to partner with various companies to deliver better care at lower cost. We don't want anything that's fee for service, which is just a different model where 10 years ago, the average hospital CEO wanted more heads in their beds. That's literally the terms they would use. More heads in beds means more dollars, means more money, means success for me as a hospital CEO, which is like the exact opposite of what you would want anyone in the healthcare system to be thinking.
So if you got people out in the audience trying to figure out where you're making investments, where are the opportunities? Where's kind of the puck going? What are the big themes that people ought to be thinking about putting your enterprise of Blue Cross hat on?
Yeah, so we'll announce the specifics next week, but we will have a successful year, and that creates an opportunity to invest. And so we've been thinking about this as strategic investments focused on our customers. And then we've been breaking that into areas. One is payer-provider partnerships. So how do you really partner with providers more deeply? 2 is what I'll call data analytics and technology. 3 is customer and consumer-facing tools, technologies, et cetera, to improve the experience of care. And then we have a 4th, which is another category, which is sort of a hodgepodge of different things. But I think you're going to see us, and many of these investments, my hypothesis is, will be in partnership with others. So actually, primary care and mental and behavioral health, if you don't mind, I know just to call them out, because I didn't earlier. I think we'll have to make investments in primary care to really have a much, there's good evidence, states, countries, systems that do well, they have a strong primary care base that's true 24/7 access, care when you need it, and literally to a level, if you're a sick, frail, elderly Medicare beneficiary and Medicare Advantage, I would send a nurse to their house to keep them from being hospitalized if need be. Wow. Mental and behavioral health, I don't know what the answer is, but I think our country is trending in the wrong direction in mental and behavioral health. You literally have zip codes where life expectancy is going down, primarily due to substance use issues. And so I think, I don't know the answer there yet. It's probably multifactorial, but I think you'll see us make significant investments in mental and behavioral health.
And when you think about healthcare value, these new models, joint ventures, NewCos, shared risk reward, can you drill down maybe even one level deeper to give people a sense of what those things might look? Who's at risk for what? How do they work, basically?
Yeah. So I think to give you one level deeper,
that's new thinking. That's not something that people are used to around here. So
no, it's and in fairness, over 80% of Blue Cross North Carolina patients right now have some tie to value, but most of them are not in these sort of full partnership models. Right. So I think on one end of the spectrum will be models like a health system where we're literally going to launch a new health plan product with them. That's a 50-50 joint venture, shared with the health system.
Right.
I think the next level down is some sort of shared savings or shared risk where you agree on the quality and cost targets and you both win or lose together. For really small primary care, they usually can't take on financial risk, so I think the model is probably going to be more similar to what we did in Medicare, where you put in population-based payments and incentives for better quality and lower cost. When you do that, primary care providers, they know that's the right thing to do, and they usually can make investments to improve. Sorry, one more story, if it's okay.
Yeah, please.
One of our Medicare models called Comprehensive Primary Care Plus. We had a doc in Arkansas, 4-doc practice. We invest population-based payments to help them redesign primary care. He said 3 things that really stuck with me. He said, 1, my patients love it. If I need to do an hour office visit, I do it. If I got to send a nurse to their home, I do it. He had bought these scales to do like remote monitoring of people with congestive heart failure in rural areas to prevent readmissions. And the scale would send data into his EHR, and then he would like call the ones that needed a change in their care. So patients love it. 2, he said, I was about to retire from medicine because he was 30 years in. He said, now I'm not retiring. He's like, I love it. This is finally the way I wanted to practice medicine. And 3, he was like, all payers put about $500,000 in this small practice year 1. He decreased total cost of care more than $3 million, so 6-to-1 plus return. But he said, $500,000, he would have mortgaged his house in rural Arkansas 2.5 times over.
Wow.
In the first year investment. So I think small primary care practices, I think the model often looks different because you really have to support them.
And I love the idea of making a big investment in primary care. I mean, you're passionate about that.
I am.
and the big reason is you just know that's where it starts.
It's interesting. Every once in a while, like a clinician will be like, well, wait, but you work in the hospital. Like, why are you passionate about primary care? I'm like, I'm still a doctor. There's strong evidence that really great primary care systems produce better results. And I think to get a really great primary care system, you do have to invest.
Yeah, and that means perhaps people can make more money. We're willing to pay more money.
Yeah, I mean, a lot of the primary care practices in our CMI models, they actually also did financially better.
Yeah.
But there's a primary care specialist issue in the U.S., which we don't have to talk about, but there is a differential on what primary care and specialists get paid.
Yes, there is. So let's talk a little emerging technologies, maybe AI, machine learning. So maybe at a base level, exciting time in healthcare, and I'll use some themes. CRISPR, affordable genetic testing, the 23andMe's, liquid biopsies, artificial intelligence, not only for drug discovery, but perhaps early cancer detection. How do you see these technologies playing a role in our lives, or maybe if we want to future project your 4 children or someday our children's children? I mean, where's that all that going from your perspective?
Yeah, on the genetics and precision medicine, I do think, and people have predicted we're on this cusp before, so I won't give you a hard time frame, but it does feel like we're on the cusp of many more predictive diagnostics, precision medicine, genetically targeted therapies, including immunotherapies. So I think that's exciting. I think there also may be an issue of like, what's the right price point for that care? 2, on the sort of AI and data point, we've got a few AI companies already working with Blue Cross. Maybe some that are, maybe even somebody in the room.
Yeah, you've been a bit of a magnet for some of these neat.
Yeah.
Well,
we're excited about it.
They know you think differently, I think.
Yeah, I'm not an AI expert, so like I would. You don't want me to predict exactly what happens because I don't know, but I do know we sit on a treasure trove of data, and we're not fully utilizing that data for good. Yeah. So I think using AI and other analytic capabilities, for lack of a better description, I'm fairly confident we could use that data for much more positive good in terms of better health outcomes for patients and lower cost.
So how about this doing good and doing well, but somehow democratizing healthcare and improving the underserved populations? I mean, how do we get these technologies everywhere? What are the pitfalls? We don't want more inequity. We're trying to help people. How do you think about that?
Yeah, so I'd say a few things. I think 1, this is something I personally think about a lot, especially the clinical population I take care of is about 50% on Medicaid. Blue Cross North Carolina has said we're planning to bid on the Medicaid business. So North Carolina is going into Medicaid managed care.
Right.
I'm excited about that. that is an opportunity to reduce disparities, hopefully eliminate disparities. Because as you provide care to a population in poverty, a population with disabilities, et cetera.
Do you know that population a little bit, or from CMS days?
I do, yeah. We were responsible for Medicare and Medicaid.
Right.
Actually, more people in Medicaid, by the way, than Medicare now.
Wow.
People don't always realize. And actually, the Medicaid, the expansion of insurance coverage as part of the Affordable Care Act, people have looked at this as people get insurance coverage,
right.
And that can come in lots of different ways. You'll notice I didn't use one key political term, but as you get insurance coverage, there's good evidence, lead to better health outcomes and lower cost. And we want to be part of that, including, to your point, addressing the disparity issues. So when we announced our $50 million investment last week, many of those investments will be squarely focused on addressing disparity issues. Mm-hmm.
Where do we go, Patrick, on when you envision man and machine capabilities, what replaces what works with what? It could be radiology, it could be any area. I mean, where does man and machine, you're a practicing hospitalist today, so how do you think about that?
I forgot that question. You might ask me that. This is an interesting one. So I think at least in the short term, it will be machine augmenting man. And what I mean by that, so radiology is a good example. Radiology is done today exactly like how I was, trained in medical school and probably 20 years before that. Man or woman sits in dark room, right. Reads screen over and over and over again. My best friend growing up is a radiologist. I'm like, I cannot believe this is what you do for a living. Are you not bored out of your mind? And nothing against radiologists if there's some in the room. Lovely specialty.
Right.
But it does feel like things like radiology, pathology, et cetera, are ripe for machine aiding man. Because, honestly, what he talks about is what all radiologists talk about, the fear of missing something.
Yeah.
They're sitting there day after day after day, and they may miss something that has a horrible ramification for a patient,
right.
And therefore call things something positive that actually aren't positive, which also have ramifications because people get biopsies and other things. So I think that's a great example where machine can augment man or woman.
So let's talk maybe a bit more provocative about data and applying maybe AI to either healthcare, but access to data. We're in a unique position having a lot of this data. What role do we play? What role does everybody play to make data available to allow for the best care?
Yeah, I'll do an example from CMS and then apply that to North Carolina. So actually, even before I went to CMS, I wrote a paper in JAMA about open data and that government should open its data because it would drive more positive change. When I came into CMS, we had a chief data officer we hired named Niall Brennan, and we worked together to get as much data from Medicare and Medicaid out into the ecosystem as possible. So all the hospital price data that Jon Stewart called a great example of like genius in government, which like Niall Brennan was like, I'm going to retire now. Star rating systems for every setting of care, downloadable API-enabled data. So I think that needs to continue at the federal and state level. Then on the private side, I think we have a role to play too. So we were actually, Niall's actually running a sort of public-private data consortium now, which Blue Cross is talking about joining. Which was the chart I showed you, was actually from his work, where they're putting data together, doing analyses, they're thinking about how they open up data from both the public and private sector so people can utilize it. And this isn't just a payer issue, it's a hospital and provider issue too. So this state, as you may know, doesn't currently have a highly functional health information exchange that everybody participates in. So actually in Medicaid managed care, they've talked about trying to force function all providers and payers to share more data, and we're very open to that.
Right, and I'll give a call out to you. Amazingly, on day 7 and 8 in the job as CEO-elect, Patrick, instead of whatever anybody else might do in the job, joined me for 2 days in Silicon Valley. Sequoia, Kleiner Perkins, John Doerr, Google, Apple, stealth companies, AI, machine learning, new models of care, the very best and brightest in Silicon Valley. I'll call them icons and legends and future ones. So for the young company people in the audience, both in North Carolina, some brilliant teams, brilliant technologies, the VC-backed crowd, how open are you to the unproven but want to change the world kind of people? I mean, there you were talking to big people and small people out west. So
Yeah. So first, thank you for that, because Steve didn't say this, but he organized most of that trip, if not all of that trip. So thank you. It was amazing.
it was day 7 and 8 on the
And
job.
it was, I think, day 7 and 8.
Yeah.
So yeah, they were like, "Where are you going?" I'm like, "I'll be back. Don't worry." No, it's incredibly exciting. I mean, and you said it exactly right, from big companies applying their huge resources to companies with 3 people,
Right.
Applying their great ideas. And I know we have some folks in the audience probably sort of been in different spaces thinking what to do next, and you can create positive change in lots of ways, but healthcare, what's more meaningful on some level? We all have had family and personal experiences with healthcare, both positive and negative. So, if you're deciding, how to launch your company that will become a unicorn, why not healthcare? Because it's, from a mission-driven passion standpoint, I'm obviously biased, but I can't think of anything better. And we'd love to partner with you and support you and think about how we could do that work together.
So willing to think different than the way people have been thinking in the past.
Definitely.
We're going to be on the home stretch here, but I'd like to ask you, just go back to CMS a little bit. What was it like having, I think you used to joke about having 500 bosses, and you worked with presidents, and how do you reflect on that time in your life, the 7 or so years as the longest serving private sector person?
Yeah. It was so I truly mean this, it was an honor to serve, and I wish more people in our country would choose to serve in that way. Because I think the impact you can have on people is huge. I actually talked to somebody who's thinking about going to the federal government last night. It's hard, it takes longer, it's frustrating, but think about the Innovation Center example I gave. We were like a tiny little startup within government with no models and no people. And by 5 years later, you got models in every state across the country. You've got savings that are estimated at 36 billion plus now. You've got quality of care results that are so much better. You've been a part of shifting the whole health system. Sorry to rant.
No.
I give the same pitch now in Blue Cross North Carolina, by the way.
No, I wanted to hear this.
So in federal government, I'd say, we're going to probably pay you less than whatever you make now, and you're going to work just as hard, but you're going to be part of changing healthcare in America. Yeah. And at the Innovation Center, we recruited a great group of people doing that.
And some young Change the World folks.
Yeah.
That take
and the White House. The
White House. That was
the White House
cool,
and
right?
Congress is what, I've done briefings in the Oval Office with various presidents, and it's surreal and bizarre, and all my kids want is White House M&Ms. They were like, "Daddy, are you going to the White House today? Make sure you get M&Ms." I'm like, it looks kind of weird if Daddy just pockets M&Ms from. They didn't care. And Congress, there's some wonderful people in Congress. The funny story I'll tell is a senator who yelled at me for 15 minutes about something, a coverage decision, and then I was like, "Oh, we're actually already doing the thing you want," once he paused. And he was like, "Oh, great meeting." And I knew he went back to his constituent and was like, "I took it out of Conway, and he did what we wanted." And probably got a big donation. So there you have it.
So home stretch and make it a bit personal here. How does being a credentialed practicing medical doctor for free on weekends change the way you think, what you do? I'm not sure people have done that before as health plan people. So.
Yeah, I learned this in the recruiting process. So apparently, we're about the 10th biggest health plan in the country now, and obviously one of the biggest blues. There's no physician leading a health plan of this size. Apparently, there's no practicing physician who's ever led a health plan of this size. And then the recruiter said, "So don't screw it up."
Right.
So I'll try not to screw it up. But I do think one, it's just part of who I am. I love doing it. You just see the healthcare system in a much more direct way. Two, it influenced my work at CMS, and it is influencing my work at Blue Cross North Carolina.
Yeah.
Because you see holes in the system where gaps occur, et cetera. And then I think lastly, in sort of interacting with other, hospital physicians, others, I think it does matter that they know you understand healthcare in a way they do.
Right.
So I think it makes that partnership a little easier.
Yeah. So how do you think about healthcare as it relates to being a dad to 4 beautiful young children. You have a wonderful wife. How does that change when you think of it from 4 kids ages 2 to 9, and they have to live in a good, healthy health and wellness world as well? I mean, is there a driver there for you as well, or what does that do to you to make you different?
Yeah, I'd say a few things. One, we just redid our wills, which is always a lovely experience to be like, if you both die together, what do you want to have happen? And you're like, I hope that doesn't happen. Right. Yeah, let's talk about that. I think a few things. One on, from a financial standpoint, I am very worried at a macro level that if we don't change, Medicare and Medicaid won't exist like it does today 50 years from now. Yeah. And so that would be a travesty, I believe, for our children, for my children. Two, on the commercial side, we've got to tackle the cost issue as well. Mm-hmm. Or once again, it will get to rationing and other things that we don't want to have happen. Mm-hmm. The customer experience, I mean, I harp on that because it's just such a huge opportunity. I got an email today from one of our employees who their families had a horrible experience in the healthcare system, and it's just, how do you prevent that from happening? I think 3, related to some of the primary care and mental and behavioral health issues. Right. We've been talking at Blue Cross literally about treat every customer like their family. Sounds really simple and probably sounds cliche, but I think if you have that centering point of treat every customer like family, the example I gave doesn't happen because you've told that customer service rep they have the authority, and that, with that child that wasn't getting his medicine, they have the authority to pull the chain, stop the line from lean manufacturing techniques, and fix the problem. Yeah. And so that's really our focus, whether it's my family or your family, and really when you insure the majority of people in North Carolina, sorry to riff on this answer, but it's great. I literally meet people every day that are insured by Blue Cross of North Carolina, and I don't tell them what I do right away. I'm just like, oh, how's that going for you? Whether it's on a plane or whatever. And you hear they're really great, and actually there's a lot of really great, which makes you feel good, but you also hear the problems that people had. Yeah. I get all our customer escalation emails, which they're like, why did you want those, Conway? I want them because it shows me when we have problems in our system. Complaints are like jewels. When somebody gives you a complaint, it shouldn't be called a complaint. It should be called a jewel because it identifies things in your system often that you can fix. Yeah. So that's our focus.
So maybe as a wrap-up question, we got some VIPs from around the nation, around the state that love our state, love healthcare. And if you can leave us with 2 or 3 or more, but let's say 2 or 3, the most important things you'd want to say, here's my thoughts and here's my advice for the future, almost to kind of boil this all down. How might you boil it down to give us some advice?
Yeah, so better health outcomes, lower cost, best-in-class service experience, but then how are we going to get there? I think, payment that's focused on alternative payment models, value, better health outcomes, lower cost, deep partnerships there. 2, I think data and analytics and technology, like other businesses, I think will drive major positive change. 3, I do think on the social determinants of health and investing in population health and wellness and prevention, I think we have a huge opportunity. And then 4th, how do you think about the customer experience journey and even like co-creating that with customers? We're doing some pilot work at Blue Cross to interact with our customers and sort of think about their journey through their eyes and then create, user-centered design, create the systems that will support them and the way they experience their customer journey. So those are the things I talk out. It's an exciting time in healthcare. Steve is terrific. Yep. I've learned a lot from him. Yeah. And it's
as you can tell, we are thrilled in our state, in our company, and frankly, you're a bit of a national treasure in healthcare, and for us to have you with us today as your maiden voyage here, Patrick, we're looking forward to the years ahead. Please join me in thanking Patrick Conway and welcoming him to North Carolina.